My name is Kylie Powell and I'm a nurse practitioner student at Auburn University. Today I'll be completing my head-to-toe assessment. Before the patient came in, we assessed his vital signs. They were within normal limits, his height and weight, BMI, and visual acuity using a Snelling chart, which is cranial nerve 2, the optic nerve. His vision was 20/20 with corrective lenses. Can you tell me your full name?
John Miller.
And today's date?
April 15th, 2019.
Okay, and please remember these 3 words. Repeat after me. Apple, house, truck.
Apple, house, truck.
Okay. All right. So the patient's skin is even. He is well groomed and well dressed. He's dressed appropriately for his age. His affect is appropriate. He is clean with no body odor. All right. Let me look at your nails, sir. His nails are clean and intact. No clubbing or spooning noted. Capillary refill is less than 3 seconds. Right? All right, his hair is even in color and texture for his age. It's evenly distributed. I'm going to palpate for any lumps and lesions. Let me know if there's any tenderness here. All right. Now I'm going to assess cranial nerve 7, the facial nerve. Can you clench down on your jaw? Okay, open your mouth. All right, smile. Raise your eyebrows. Frown. And puff out your cheeks. All right, so the facial motor and trigeminal sensory nerves are intact. Now I'm going to assess the cranial nerve 5, the trigeminal nerve. All right, clench down for me. I'm going to palpate the TMJ region. Any tenderness?
No.
Okay. All right, now close your eyes for me and tell me which side of your face I'm touching, left or right.
Left. Right. Left.
Okay. Now I'm going to palpate your sinuses. Okay. Now I'm going to look into your nose with a pen light. Okay, do that for me. All right. Nares are patent and even and open. Midline. All right. Can you occlude one nostril for me? And then breathe in. Okay, the other one. Okay. Now I'm going to assess cranial nerve 1, the olfactory. All right. Occlude one nostril. Tell me what you smell.
Alcohol.
Okay. Other one. Tell me what you smell.
Alcohol.
Okay. Cranial nerve 1, olfactory, is intact. All right. So now I'm going to look inside your mouth. Okay, open up. Okay. I'm assessing cranial nerves 9 and 10, glossopharyngeal and vagus. All right. So the oral mucosa is pink and moist. Teeth are intact and in line. No missing teeth. All right. No signs of halitosis. Say ah.
Ah.
Let me get my tongue depressor. 1 second. Okay, so yeah.
Ah.
Okay, the uvula movement is appropriate. All right, the gag reflex is intact. Okay, can you move your tongue to the left, to the right, up, down? Okay, now back in your mouth. All right, now stick your tongue out straight. Okay, cranial nerve 12, hypoglossal nerve is intact. All right, now I'm going to look at your eyes. All right. So the eyes are symmetrical bilaterally. The eyebrows are directly over the bony prominences. They are even. Upon inspection, no signs of any deformity. All right. I'm now going to look into the eyes. Okay, the conjunctiva is pink. The sclera is white and the iris is blue in color. All right, so now I'm going to get my pen light. Okay. So the pupils are even, round, reactive to light and accommodation. Now I'm going to assess the cranial nerves 2 and 3, optic and ocular motor. All right, I'm going to shine the pen light directly at your nose. Okay, So the eyes, the pupils are reactive to convergence and accommodation. So that those cranial nerves are intact. All right, now I'm going to assess cranial nerves 3, 4, and 6, ocular, motor, trochlear, and abducens, with the 6 fields of gaze. Okay, so follow my fingers with your eyes only. All right, so his peripheral vision is intact. Okay, and so now I'm going to look into his ears. Okay. So the ears appear to be equal and even bilaterally. The auricles are normal in shape and size. Okay, no tenderness noted. I'm now going to look into the ears. So for adults, you pull up. Okay. The tympanic membrane is pearly gray and intact. The cone of light is visible. So I'm now going to test cranial nerve 8, the acoustic nerve. Okay. I'm going to perform the Weber test. Let me know if you hear the vibration in one ear or both ears.
Both.
Okay. Now let me know when you can no longer hear it.
Now. Now.
Okay, that was the Rhine test performed. Okay, now I'm going to assess the neck. It is even in color for ethnicity. No signs of trauma. Okay, I'm going to test your range of motion. Can you move your head to the left? Like this. Okay, now to the right. Now chin to chest. Okay, and back. Okay, now I'm going to palpate your lymph nodes. Cervical chain. Let me know if there's any tenderness. Okay. Now I'm going to palpate your carotid arteries here. Okay, now I'm going to listen to the carotids. I'm going to listen to the carotids with the bell of my stethoscope. Look that way, sir. Okay. This way. All right, no bruits were noted. Okay, and so now I'm going to palpate the trachea. It is midline. Okay, and now I would get behind the patient and I would palpate the thyroid gland. Any tenderness?
No.
Okay, can you swallow for me? Okay, good job. All right, now I'm going to go down to the chest and the respiratory system. All right, so the chest is even and symmetrical. The AP diameter is 2 to 1. All right, so now I'm going to, can you turn this way for me, sir? Okay, you can stay sitting up. All right, so I'm going to palpate for bilateral chest expansion. Okay, deep breath in. Good. Okay. Now I'm going to assess for tactile phreatitis. Okay, so say the word 99.
99.
Again.
99.
Again.
99.
Okay, now I'm going to do the front.
99. 99.
Okay, no tactile phreatitis was noted. Okay, so now I'm going to percuss the lungs. Deep breath. Deep breath. Deep breath. Deep breath. I'm going to do the front lobes. Deep breath. Deep breath. Okay. Resonance was percussed throughout all lung fields. All right, and now you can spin your legs around towards me. And now I'm going to listen with my stethoscope. Okay. I'm also going to check for CVA tenderness. Okay. So let me know if this is tender. Any tenderness?
No. No.
Now I'm going to listen. First anteriorly and then posteriorly. Right, deep breath. Again. Okay, deep breath, sir. Okay, again. Deep breath. Okay, now spin around for me one more time. Now I'm going to listen to your posterior lung lobes. Deep breath. Deep breath. Deep breath. Deep breath. Okay. Good job. Okay, all lobes were clear anteriorly and posteriorly. So now we're going to move on to the heart. All right, so first you always inspect. Everything is even and symmetrical bilaterally. All right, so I'm going to listen to the heart first with him sitting up with my diaphragm. So you do the 5 points. So apical. Tricuspid, Erb's point, I'm sorry, this was apical, pulmonic, Erb's point, tricuspid, and mitral. So after I listen with the diaphragm, then I listen with the bell. Okay, now can you lay down for me, sir? So diaphragm first, and then the bell in the 5 spots. Now I'm going to listen to the bell. All right, so no murmurs were heard. S1 and S2 were noted with the regular rate and rhythm. All right, you can sit up for me one more time. Sorry. Okay, so now I'm going to palpate the pulses. So first I would do the radial pulses in both arms for 1 full minute. Okay, and then I would do brachial. Bilaterally. And then carotid, and it's always important to just do 1 carotid artery at a time. Okay, look this way. Okay. All right, and I'm sorry for the change in position, sir, but I'll need you to lay down for me one more time.
Gladly.
And then you will also palpate the femoral regions. You can stay laying down. Now we're going to move on to the abdominal assessment. So first you inspect the abdomen. All right, it is even in color. No pulsations. Okay, so I'm going to listen with my diaphragm in all 4 quadrants. Okay, so active bowel sounds were heard. And now I'm going to listen with my bell for any bruits. So I'll do the iliac, renal, and the femoral. Okay, no bruits for auscultating. Okay, so now I'm going to percuss all 4 quadrants to check for the liver and the spleen and their sizes. Okay. And now I'm going to palpate the abdomen. Let me know if there's any tenderness. All right. There are no palpable organs. All right. So now I am going to elicit the abdominal reflex. Okay, the patient should flinch. This is normal. All right, now you can sit up for me, sir. All right, now moving on to the musculoskeletal. So his arms. So I'm going to assess his muscle and grip strength. So can you squeeze my hands? Okay. Okay. All right, so now I need to get 2 objects. Close your eyes for me, please, sir. Okay. So please tell me if this feeling is dull or sharp.
Sharp.
I'm sorry, soft or sharp?
Soft. Soft. Sharp.
Okay. All right, now close your eyes and open out your hand. Tell me what object I just placed in your hand.
Can I close my hand?
Yes.
That's a paper clip.
Okay, good job. All right, you can open your eyes now. Now we're going to do the finger to nose test, okay? So put your finger on my finger and then touch your nose with your finger. Okay, again. Okay, now the other hand. Good job. All right, now I'm going to assess his deep tendon reflexes. Okay, so first I'm going to do his biceps. So flex. Okay, all this one. Okay, now his patellar. Okay, and then the Babinski. Okay. So now, can you shrug your shoulders for me? Okay, rotate. Good job. That's assessing cranial nerve 11, the accessory nerve. All right. Now, straighten your arms out and bend at the elbows. Assessing range of motion here. All right. Now your wrists. Can you rotate your wrists? Okay. All right. And so now I'm going to look at your legs. All right. So there's venous blood flow is normal bilaterally. All right, he has good muscle tone and strength in his legs, and there's hair growth that is natural. All right, so now can you rotate your ankles? Okay, in and out, both ankles, range of motion, full range of motion there. Okay, I'm gonna look at your toes. All right, capillary refill is less than 3 seconds in his toes. Okay, can you push down like you're pressing on the gas pedal? Okay, now don't let me push your foot up. Okay, good job. Very strong. All right, so now can you stand up for me? Okay, and rotate your hips in and out. Rotate out. Move your hips. Okay. Okay. Now I'm going to assess your pulses. This is the popliteal pulse behind the knee here. Okay. Dorsalis pedis on top of the foot. All right, and then posterior tibial inside the ankle. Okay. And so now can you bend over for me? Face this way and bend over. Okay. The spine is midline, no signs of scoliosis. All right, you can stand up now. Okay. So now can you stand and have your eyes closed, arms by your side? Okay, no swaying noted, so the Romberg test is negative. All right, and now can you walk with your heel to your toe? Okay, back. All right, now can you walk back and forth on your tippy toes? Good job. Now can you repeat the 3 words that I told you in the beginning?
Apple House truck.
Good job, Mr. Miller. That concludes my head-to-toe assessment.